Sphenoid Bone, Part 2. Greater wings. Introduction. The greater wings are two strong processes of bone, which arise from the sides of the body and are curved upward, lateralward, and backward. The posterior part of each greater wing projects as a triangular process which fits into the angle between the squama and the petrous portion of the temporal and presents at its apex a downwardly directed process, the sphenoidal spine, also known as spina angularis. Greater wings, superior surface. The superior or cerebral surface of each greater wing forms part of the middle fossa of the skull. It is deeply concave and presents depressions for the convolutions of the temporal lobe of the brain. At its anterior and medial part is a circular aperture, the foramen rotundum, for the transmission of the maxillary nerve. Behind and lateral to this is the foramen ovale, for the transmission of the mandibular nerve and accessory meningeal artery. In the posterior angle, near to and in front of the spine, is a short canal, sometimes double, the foramen spinosum, which transmits the middle meningeal vessels and a recurrent branch from the mandibular nerve. Medial to the foramen ovale, a small aperture, the foramen vesalius, may occasionally be seen opposite the root of the pterygoid process. It transmits a small vein from the cavernous sinus. Greater wings, lateral surface. The lateral surface is convex and divided by a transverse ridge, the infratemporal crest, into two portions. The superior or temporal portion, convex from above downward, concave from before backward, forms a part of the temporal fossa. The inferior or infratemporal portion is smaller in size, concave, and enters into the formation of the infratemporal fossa. Its posterior part is the spina angularis or sphenoidal spine. Medial to the anterior extremity of the infratemporal crest is a triangular process. Extending downward and medialward from this process onto the front part of the lateral pterygoid plate is a ridge which forms the anterior limit of the infratemporal surface. Greater wings, orbital surface. The orbital surface of the greater wing, smooth and quadrilateral in shape, is directed forward and medially, and forms the posterior part of the lateral wall of the orbit. Its upper serrated edge articulates with the orbital plate of the frontal. Its inferior rounded border forms the posterolateral boundary of the inferior orbital fissure. Its medial sharp margin forms the lower boundary of the superior orbital fissure. Its lateral margin is serrated and articulates with the zygomatic bone. Greater wings, margins. Commencing from behind, that portion of the circumference of the greater wing which extends from the body to the spine is irregular. Its medial half forms the anterior boundary of the foramen lacerum and presents the posterior aperture of the pterygoid canal for the passage of the corresponding nerve and artery. Its lateral half articulates with the petrous portion of the temporal. In front of the spine, the circumference presents a concave, serrated edge for articulation with the squamous portion of temporal. At the tip of the greater wing is a triangular portion for articulation with the sphenoidal angle of the parietal bone. This region is named the pterion. Medial to this is a triangular, serrated surface for articulation with the frontal bone. Lesser wings, surfaces. The lesser wings are two thin triangular plates, which arise from the upper and anterior parts of the body, and, projecting lateralward, end in sharp points. The superior surface of each is flat and supports part of the frontal lobe of the brain. The inferior surface forms the back part of the roof of the orbit and the upper boundary of the superior orbital fissure. This fissure is of a triangular form and leads from the cavity of the cranium into that of the orbit. It is bounded, medially by the body of sphenoid, above by the lesser wing, below by the medial margin of the orbital surface of the greater wing, and is completed laterally by the frontal bone. It transmits several important nerves, including the oculomotor nerve, trochlear nerve, abducent nerve, and the 3 branches of the ophthalmic division of the trigeminal nerve. Lesser wings, borders. The anterior border is serrated for articulation with the frontal bone. The posterior border, smooth and rounded, is received into the lateral fissure of the brain. The medial end of this border forms the anterior clinoid process. The lesser wing is connected to the body by 2 roots, the upper thin and flat, the lower thick and triangular. Between the 2 roots is the optic foramen, for the transmission of the optic nerve and ophthalmic artery. Thank you.